In this video, I will tell you 5 things that every patient should ask their surgeon. My name is Dr. Camacho, and I have almost 20 years of experience operating on patients and counseling patients prior to surgery. The first question is whether or not surgery is indicated in your specific case. I get many referrals from primary care providers. Patients come in often thinking that they will be candidates for surgery, but after reviewing their history, their physical exam, their images, we determine that they're not actually a candidate for surgery. And sometimes a patient is referred and they think they are not a candidate for surgery. And after reviewing their history, physical, and images, they actually are a good candidate. And I explain why or why not for each patient. The second thing you should know is what the medical treatment options are that could be used instead of surgery. Medical treatment options could include physical therapy, yoga, medications, injections with steroids, or treatment with braces, weight loss. It all depends on why you might have surgery, but the surgeon can explain medical treatment options prior to you having surgery. Another question to ask is the typical recovery course. For example, you may need to be bedridden for a period of time. You might need to avoid going to the gym, avoid swimming for a period of time. And at some point, you may start exercising gradually or slowly, and then eventually can get back to normal. The timeline for all of this is very different. For example, if a patient has a tonsillectomy, they should not eat sharp foods. They should avoid exercising vigorously for a couple weeks. And the reason is if you exercise heavily, you might start bleeding. If you have nasal surgery or other surgeries, you may not want to get the wound wet because that could predispose you to an infection. Another important question is who exactly will be doing your surgery? As surgeons, we often may have a co-surgeon with us, and that could be a trainee called a resident. It could also be a more senior surgeon or a more experienced surgeon for that specific surgery. For example, if I'm doing a facial trauma surgery, sometimes I will involve another surgeon for many reasons. Number one is sometimes it's really difficult for one person to do the surgery alone, and you need another set of hands, especially someone with experience. And sometimes the approach for the area may be very challenging, such as getting to bones that are deep and there's facial nerves and other tissue that can be difficult. Another question is what are the common risks of surgery and what are the rare risks of surgery? Common risks typically will include infection, bleeding, need for further surgery, pain, scarring, and usually the rare complications would be deep vein thrombosis, which is like a blood clot that forms in your legs and it can spread to your lungs, called a pulmonary embolus, heart attack, stroke, sudden death. Like all these very rare complications could happen. However, your surgeon will explain specifically in your case. Sometimes if we do a cancer surgery or an emergency surgery, the risks are definitely going to be different. And you as a patient should know what those risks are prior to surgery. Please remember that your surgeon wants the best for you and you are one team, right? As part of the consenting process, before you sign the form, we will explain the risk, benefits, alternatives, why we're doing the surgery. We want you to have ample information. We also want you to be able to ask any questions and feel comfortable prior to the surgery.